Hi YouTubers, this is M. Welcome to my channel. I will be keeping some YouTube videos to document my class 3 malocclusion surgery. I have an underbite, as you can see, and I will be moving forward with jaw surgery for functional and TMJ purposes. Some helpful tips that I can give you before moving forward with or deciding to go with this surgery is do a lot of research. It's great to have extensive knowledge of what you will be going through, and so it's good to do a lot of research. I personally have done a lot of research into this surgery itself because I wanted to know what I should be expecting when the surgery is completed. I have also watched a lot of different YouTube videos just to gain some knowledge in reference to what I should be expecting before, during, and after the entire procedure is completed. And so those are some really good tips. Go ahead and do some research if you're currently looking into getting this completed. This is a big surgery, so it's not a small surgery that you should just, one day wake up and consider. It is a huge surgery that can be life-changing. Other than that, I wanted to talk a little bit about insurance and cost. I don't know exactly how much it's going to cost. A rough estimate, as I think, could be around $25,000 to $40,000, depending on what you're going to have completed. Don't quote me though, because I'm not sure. I haven't gone through the process. I'm just in the very beginning stages of the entire process, and so that is something that you might want to think about. About insurance coverages now. Some insurances do cover. I don't know if they all do. You would have to check your benefits information about that. The state that I live in, I have looked into the insurance coverages and fortunately have found something that will work for me. Specifically, I don't know too much about insurance. Insurance is kind of a Greek language to me, and so it's hard for me to understand going into the entire process and looking at insurances and that type of stuff. However, I did do a lot of extensive research as well, pertaining to insurance, and I feel like I have a better understanding of it. However, I'm not an insurance person, so I don't really know too much about that. So going forward, I have decided to go ahead and move forward with the process of the reconstruction surgery to go ahead and fix my underbite. I do have a lot of TMJ, and so that's pretty much joint pain where your jaw is right here, migraines, jaw locking once in a while, just anything that involves your jaw and strain in your joints where your jaw is located. And so I'm pretty excited about the entire process. And as you can see, I don't have any braces as of yet. I just completed all of my dental appointments to get my fillings put in, teeth cleaned. I had periodontal disease, and that's something that's very common because I am a smoker, and so it is very common to get periodontal disease, and you can get it through anything. I mean, it's pretty much just your gums being very inflamed, and so I had to get a deep cleaning done. So that took some time. It took about a month for me to go ahead and get, or almost 2 months actually, for me to go ahead and get all my dental stuff completed. And so now I'm in this second stage where I'm ready for my braces, and so I'm pretty excited about that, which I know it shouldn't be anything to be excited about, but it's exciting to me because I know that I'm getting somewhere, and I'm getting closer to that end where I can see that end result. So it's pretty exciting to me. So today is March 2nd, 2014, and I will be getting my braces put on tomorrow, March 3rd, 2014 at 10 a.m. And so I'm excited for that. I can't wait for that to straighten out my teeth. As you can see, horrible teeth. And so after that's completed, I know that I'm probably going to have to wait for another possibly year, 10 months to a year, to even be able to go into the procedure of the surgery, which I'm fine with, I mean, I just want them to do whatever they need to do to go ahead and get it corrected and make sure that everything is in the correct place to go ahead and, get it done, because I don't want there to be any complications that shouldn't be there. So I also went last Friday. Actually, it was like the 21st. Sorry, I just stumbled there on my words. But it was the 21st of February. I went to go to see my oral surgeon, and he did say that I was going to just be getting, or he said that just assume it's a double jaw surgery. However, what he is going to do first is he is going to move my top jaw, and he's going to cut from right here and move my top jaw forward. And then after he does that, he'll go ahead and see how my teeth aligns, and if necessary, he will move my bottom jaw back a little bit if necessary. So that's kind of exciting, knowing that it might not have to be double jaw surgery. It might just be my upper jaw. But I'm just hoping that he would do what is, in my best interest, and hopefully at that point, when he does make that decision to do the upper or lower surgery or the incisions, that he will do whatever works best for me. So, other than that, after I saw my oral surgeon, he really just gave me a lot of information as well about the surgery itself and what to expect pre and post-op. And so it was really good to be able to see him and just kind of know that type of stuff. Let me see. Other than that, I think that's it. And so go ahead and follow me. If you are someone who's going to be having a jaw surgery done soon, I recommend you watch these videos. Not just mine. Anybody who has ever gotten their jaw surgery completed, go ahead and watch the videos. They are very helpful. Follow me if you want to, if you're someone who's getting jaw surgery, or if you're just watching it because someone you know is going to be going through this process. It is going to be very helpful information for you to know. If you want, of course. But let me go ahead and just show you my profile shot. And must I warn you, I do have a very sunken in face. So don't be scared. It is very common for people who have an underbite to have a sunken in face. So let me go ahead and show you. Okay, and let me show you the other side. Okay, and these videos specifically aren't just for, someone who's going through the process. It is just for myself as well, just so I can kind of keep a timeline of what happened during the entire process, and my before and after, and how I will look like, with the end results in the near future. So go ahead and subscribe below.